Great. Welcome to everyone to our lecture today. This is called the Loren Leclezio Lecture, and it's the 2024 edition of this lecture. It's a very special lecture in the annual calendar of the Social Responsiveness Committee of the Department of Psychiatry and Mental Health at the University of Cape Town. I'm Professor Beatrice de Vries, and I'm just going to tell you a few things about the Loren Leclezio Lecture and about Loren Leclezio herself. And then I'm going to introduce our presenter for today. So I hope you all enjoy the beautiful logo of the Social Responsiveness Committee. And let me just say a few words about Loren and this lecture then. So Loren was a developmental neuropsychologist. She was a master's student in the department between 2012 and 2014. She was a PhD student between 2014 and 2017. And she was an author of 7 papers on tuberous sclerosis complex, which is a rare disease, and you'll hear a little bit more about that later today. And she was very much a champion for working in collaboration with individual families and the communities affected by TSC. And she was a true believer that research can be a tool to empower communities. Loren was a wonderful person. She was an entrepreneur. She had her own company. She was a beautiful wife and a mum and a wonderful friend and colleague. And she died in January 2018 after a short battle with cancer. And so in honor of her work, in the spirit of all the work that she had done, the Social Responsiveness Committee decided to have an annual lecture in her honor. Here are some photos of Loren in different activities and positions and winning awards, etc. And you might see some of these images again in today's presentation later as well. And this picture I added just to show, there's Loren at the back. And this is a group, an early researcher, an emerging researcher group. Loren was the one who said, let's start some emerging researcher activities at all our conference. And in fact, this was the very first one we did in Stellenbosch in 2017. And since then, we've introduced it in many child psychiatry and a number of other conferences as well. So really just showing also how her thought ideas to empower and to build capacity in a new generation of researchers as well lives with us to this day. So the lecture itself is an annual lecture, as I've said, in the context of the department, and we invite a clinician or an applied scientist who really exemplifies the spirit of socially responsive and community-based participatory research. That's kind of a theme. Every year we look for somebody. We try to alternate into national and local speakers. And here's the list of people who've done the lecture so far. I kicked it off in 2018 when it was the first time. Then we had Marijte de Jonge from the Netherlands, followed by Lebo Moletsane from KwaZulu-Natal. We had our dean, Prof Lionel Green-Thompson in 2021. We had Liz Pellicano from London in 22. We had our own Professor Linda Tron from the University of Pretoria last year. And this year, we have all the way from Antwerp and Brussels, Professor Anna Jansen. So you can see we have more women than men because we're deliberately also in Loren's spirit trying to select more female presenters than male presenters. So just a few words about Anne. She is a pediatric neurologist by training and is trained in Belgium and in Canada and in France as well, if I remember correctly. And she was based in Brussels for a long time and now is the head of the pediatric neurology unit at the University of Antwerp, where she also lives. She has an interest in cortical malformations of the brain, the study of them, and she also has an interest in tuberous sclerosis complex, the condition that Loren did a lot of her, or all her master's and PhD work on. And so Anne also knew Loren, and I thought, therefore, it would be a perfect opportunity for us to invite Anne to do this year's Loren Leclezio lecture. So Anne, I'm not going to say any more about you. People can Google you while they listen to you, but I'm very happy I'm going to stop sharing my slides and invite you to deliver the 2024 Loren Leclezio lecture.
Thank you very much, Petrus, for this invitation. I'm very honored to have been invited to give this year's Loren Leclezio's lecture in her honor. And the lecture is entitled Participatory Research in Rare Diseases, because I think that is really also what Loren was very a champion of, to work with communities, as Petrus said. And the rare disease that I will use as an example today is the rare disorder tuberous sclerosis complex, or TSC. So this is the outline of my talk, or what I will discuss in my talk. So I'll use TSC as an example, and we did a participatory priority setting exercise in TSC to set priorities for research in the field. And that led to the identification of TSC-associated neuropsychiatric disorders, which I will abbreviate as TAND, as a priority domain for research and clinical service needs. And based on that exercise, the first ever specific grant for research on TAND was awarded by the King Baudouin Foundation in Belgium. And that enabled us to start an international co-creative project, the Tandem project, which truly is Loren's legacy. And I will introduce that to you later. So first, just to make sure that we're all on the same page, just a very short introduction about tuberous sclerosis complex. So it is a genetic disorder, and it is a multi-system disorder. So it can affect virtually every organ in the body, with frequent involvement of the brain, the kidneys, the skin, the lungs. And also these different clinical aspects or symptoms do not occur all at the same time, but they can occur in different stages of life, and that makes it the follow-up and the management more complex, because we need to be attentive to all these different systems, and the presentation can change throughout the lifetime. So as I said, it's a genetic disorder. It can result from a pathogenic variant in either the TSC1 or the TSC2 gene, and they code for two proteins, and the role of these proteins is to put a brake on the mTOR pathway. And the mTOR pathway leads to or has influence on a wide range of cellular processes. And so when these proteins don't function normal, this brake is lost and this pathway is overactivated. And that's underlying the different aspects, clinical aspects that we see. For a very long time, a lot of attention went to the better awareness, better diagnosis, improved management of all these medical aspects of the disorder. But it was clear, and so management recommendations were developed, which you can see here. This is really the recipe book for follow-up of individuals with tuberous sclerosis complex. But it then became clear that there was a big gap with respect to the TSC-associated neuropsychiatric disorders. And that's what I will highlight more, because it's really at the core of this project. And so in the next part of my talk, you will hear different keywords: TAND levels, a checklist, and clusters. So TAND, or TSC-associated neuropsychiatric disorders, affect approximately all individuals with TSC. But in a survey that was carried out in the UK in 2010, it became clear that less than 20% of individuals received any assessment or treatment for these manifestations. So it was clear that there was a significant identification and treatment gap, despite the fact that already since 2005, there were very clear recommendations as how to evaluate and manage these difficulties. So when Prof de Vries and the committee for the recommendations of TSC came together in 2012, we sat together and we thought we should find a way to raise more awareness for this specific aspect of the disorder. And that is when we borrowed from the HIV community that had coined the term HIV-associated neuropsychiatric disorders, to also integrate the same concept in the TSC community and coin the term TAND, just to have an umbrella term to cover different aspects, because we also were aware that people were speaking different languages and mixing different terminologies like behaviors and specific psychiatric diagnosis, or other neuropsychological deficits, and it was just one big mix. And also with respect to research, that was very difficult because it was difficult to compare different studies because of this mixed terminology. So therefore, we developed a TAND as an umbrella term covering 6 different TAND levels. And you see these levels here, the behavioral level, the psychiatric level, covering formal psychiatric diagnosis, intellectual ability and the intellectual profile, academic skills, writing, reading, spelling, math, specific neuropsychological processes such as attention, dual tasking, executive functioning, and then very importantly also the impact on the individual with the disorder, him or herself, and on the family and carers around this individual, so the psychosocial level. And to help or assist with this more systematic evaluation and to increase the awareness around TAND, a checklist was developed as a guideline for a clinical interview or an aid memoir, and Loren was instrumental in the development of this checklist, and she also did a pilot validation of this checklist, as you can see here, as part of her master work. The checklist has then been translated in over 20 different languages, which you can find on the TAND Consortium webpage. But then we were confronted with a next challenge, and that is that every individual with TSC has a TAND profile that can be very specific or very unique. And the profile of one individual does not really compare to another. And so when we would refer individuals to, for example, a psychologist, for further support and guidance, very often people said, but I don't know anything about this rare disorder TSC, or I'm not familiar with this specific unique profile, so I cannot really help. And so this led to a treatment paralysis. And to try to tackle that, Loren proposed to use data clustering methods to reduce this complexity and to see if we could identify natural TAND clusters. And here you see the identification of 7 natural TAND clusters that was part of her PhD work. And on the right-hand side, you can see there is an autism-like cluster, a mood and anxiety cluster, a dysregulated behavioral cluster. And I think you can imagine that when we would identify this and refer people to a therapist and say, or even have a discussion in a school or the work environment, when we speak about a mood disorder or autism, these are concepts that are much more familiar and better known also in the community than when we speak about TSC or a specific TAND profile. So that has helped, and she, through different studies, identified and confirmed these different clusters. So that's my introduction. I'll now shift gears a little bit to the priority setting exercise that we did in TSC. And that was inspired by a stakeholder, by a workshop organized by the King Baudouin Foundation in Belgium, where they did a multi-stakeholder dialogue for priority setting in health research, really focusing on the fact that the research agendas very often are set by the priorities of research sponsors or academia or academic researchers, assuming that they match the needs of the people that use the research. But these agendas often undervalue and underuse the specific knowledge and expertise of patients, caregivers, healthcare providers, policymakers, the public, and the community at large. And that could use to a serious mismatch. And I was really inspired by this concept, which I think now is much more embedded than at the time when we did this exercise. But we then proposed to use TSC as a pilot project. And so in this project, we had 2 different arms. After involving the people and setting a committee, we identified individuals with TSC and their families and caregivers on the one hand, and professional experts on the other hand. And we did separate priority setting exercises in these 2 big groups. And very importantly, then we came together and we explained our priorities to each other, but we just not said like, oh, these are our respective lists, but we try to also articulate why we identified these specific priorities so that we could understand each other's reasoning behind these specific processes. And together, after this dialogue, we came to top top 15 research priorities. I'm just going to show you the top 5. Very importantly here, TANT was identified as the research priority #1 in TSC. And this was in 2018. Again, was also identified as the most neglected research topic so far. And so this led to the commitment of the King Baudouin Foundation, together with a TS association in the UK, to fund a project specifically on TAND. And so the first project that was developed was the Tandem project, which I will highlight now. And the concept of this project, the need of what the basis, the foundation, the aims that we addressed, resulted from Loren's work in 2016. So really in parallel with the priority setting exercise, she did participatory-based focus groups with people in South Africa, the USA, Europe, and Australia, involving a wide range of stakeholders. And from that work, it became clear that the next steps that the community needed after the coining of the term TANT and developing the TANT checklist was that families really wanted a self-complete version of this checklist. So they did not want to depend on a clinician or another healthcare provider to interview them and go through the checklist together, but they wanted to have that in their own hands. And they also wanted a quantified version of the TANT checklist. The initial version just had yes/no answers, but they also wanted to be able to score severity of certain behaviors or problems. They prefer to have it integrated in a smartphone app, not just on paper. And they also wanted it to come with a toolkit of advice, information, and recommendations and strategies for themselves to help TANT manifestations while they were waiting for referrals to expert clinicians or therapists that could really walk the journey with them. So from this work that Loren did, the aims of the TANT project were developed, and it's a truly international multi-stakeholder participatory research that uses technology to empower families. Here you can see the international aspect of the consortium, and here, very importantly, the family representations group that are involved in every step and in every committee of this consortium, just to make sure that they serve as our compass and help us navigate our journey throughout this research project. And so based on Loren's recommendations and our earlier work, these 3 aims were developed: the development of the self-complete TANT checklist, integration into the app, consensus building, making recommendations, developing a consensus toolkit, integrating this to the app, making sure it's validated, and in parallel, as you already heard from Prof. De Vries, capacity building exercises to make sure that this is something that is sustainable also in future, and we'll have next generation researchers that can take this work further. So the protocol of this paper was published in the Frontiers in Psychiatry. You find a reference here. Also important to share this with the community, also for other rare diseases, for example, that people can share. So I'll briefly take you through the different aims of the project. So the first aim was to develop or to adapt the TANT checklist that we had initially developed and validated, and that Loren had validated, to this TANT SQ, self-report quantified version. So to do that, we first looked at issues that were missing maybe from the initial version, also decisions on how to quantify the checklist. We prepared a typeset, and then we did a first review. Then we went to the community, to our consortium at large, and to the TSC community through the TSC Alliance. And we asked for feedback from the community to see, to check feasibility and acceptability of this new version of the TANT checklist. Based on their feedback, a number of additional adjustments were made, and that led to the final version of this TANT SQ. Here you just see a short overview of the feasibility and acceptability feedback that we got from the different respondents here from the TANT consortium members. And you see that overall, for the different aspects, the new TANT checklist scored very well. from the feedback from the users, what came back was very important, two very important findings. On the one hand, that when they were on their own, sitting on their own, filling out this paper form, they said like, we list a lot of difficulties and problems, but it's also important that when we want to tackle these and when we want to manage these, it's important to be able to work from the strengths of an individual and to not forget all the things that work well and that are positive. So this is something that we kept in mind and that we added to the final version. And also families really wanted to make sure that they also had tools in hand and follow-up steps. So again, a call for this toolkit, as Loren had already identified from the beginning. So here you see an example of what it looks like, this TANT-SQ on paper. And then it has been published again. It's freely available. So the English version at this moment is downloadable through the link of this paper. And then the next step was to integrate this toolkit into a smartphone app, which you just see a couple of screenshots here. So after registering, people fill out a number of details on their TSC profile, and then they go through an electronic version of the TANT checklist. And then in the end, they will automatically be able to see the cluster profiles and see what the severity per cluster is. And that could give them a first idea on what to think of first as next step, or it might also facilitate a discussion with their clinician to say, I filled out this form and this is the profile that results, and can you now help me to think with me about next step? But again, it might be easier for clinicians to see, for example, there is a very high score on the mood and anxiety cluster. Then this is something that we could address in more detail. And we know that mood and anxiety problems are amenable to treatment, just as in non-TSC individuals. So that might facilitate referrals and next steps. Again, we did a feasibility evaluation of this version, and you can again see that it was very positively rated in this app version of the checklist. And again, very similar to the paper version, people really ask how to use these results. Next step, ask for a toolkit. So that led us to the second aim, the development of the TANT toolkit, and we went to different steps. We first, the consortium was divided per cluster in small groups, and they went to the literature, they reviewed the literature on what is available on these specific clusters, specifically for TSC. And when we did not find much evidence for management guidelines or recommendations in the TSC literature, then we would go outside of the literature in TSC. For example, for the autism cluster, we would look, what do we know about autism in TSC? And we would also look like, what are recommendations for autism in the general community outside of TSC specifically. We also developed a scoping review, and then we developed specific consensus recommendations, and these formed the basis of the development of the toolkit. So I'll take you through these different steps. I'll start with the scoping review. So that was really to describe the research landscape of TANT and to identify knowledge gaps of TANT research that could inform also further priority setting and recommendations for future research in this area. So very briefly, what we identified is that since coining the term TANT, there clearly is more awareness and research also in this domain. Very clearly, the research is coming predominantly from high-income countries, and low and middle-income countries there is very few or very little research. And it's very important that we can increase this also to make sure that we take into account the cultural contexts and broader cultural context than what we have done so far. With respect to the levels, we see that the academic and psychosocial levels are underrepresented in the research so far. There are no interventions, non-pharmacological interventions in TANT so far, so that is clearly needed. Remote technologies have been used very little, and also with respect to the clusters, the scholastic cluster is under-researched. So the results of this exercise have been published in the Journal of Neurodevelopmental Disorders in 2022. It's also freely accessible. And then we move to the next step, the recommendations for TAND. In line with the general recommendations for the evaluation and management of TSC, we wanted to develop more specific recommendations for TAND. And here you see just how over the years already our recommendations have become more and more refined with respect to the topic of TAND. And in the 2021 general TSC recommendations, we said that it's important to do a comprehensive assessment across all levels of potential TAND manifestations, to screen annually for TAND using a validated screening tool, for example, the TAND checklist, to also make sure that we provide parent and caregiver education and training about TAND, and that we provide psychosocial support to families. So we did an exercise within the consortium, again, based on these different groups. People reviewed the literature, and per chapter or cluster, they developed summary statement and recommendations. And we presented all these to each other, and we voted electronically. This was also during COVID, on the prioritization of these cluster-specific summary statements and recommendations. And then during a consensus conference that we held online with all the consortium members, we did one big priority setting exercise, and we realized that there were a couple of principles that were in common throughout all the different clusters, and we decided to identify them as core principles. And then we voted about the cluster-specific recommendations and developed our final set. And here you see visually a representation of these recommendations. So 10 core principles that are at the heart of what a TAND follow-up should look like, then cluster-specific recommendations, and then holding the whole system, all this together are the wraparound, the recommendations for the psychosocial cluster, like a wraparound concept. So I'll briefly go, just quickly checking on time, I'll briefly go through the core consensus recommendations, because I think they might resonate with you, not specifically for TAND, but for many different other conditions that we encounter in clinical practice. So for TSC, it's very important to realize that everyone with TSC, also individuals with normal intellectual ability, are at risk of TAND. Therefore, it's important that everyone with TSC receives a lifelong monitoring for the emergence of TAND, because it's not in childhood that the profile is set and that it's not evolving. Things can emerge over time. It's important to screen at least annually for TAND, and very importantly, not to screen and then park the checklist in the patient file, but to screen and make sure that if there are difficulties, to ensure follow-up action, to follow up with appropriate action. Goal is early identification and early intervention. It's also important to realize that when there are difficulties in one specific TAND clusters, that it's highly likely that there also will be problems in another cluster. So TAND clusters cluster together, and it's important to keep an eye on the entire profile of an individual. It's always important to consider the impact of physical health problems and medications, such as epilepsy and anti-seizure medicines, which are, epilepsy is very frequent in TSC, and that can also impact TAND or have an influence on TSC. So when we make an assessment of TAND, it's important to make sure that we don't lose track of the underlying physical conditions. Important to work with families and caregivers as lived experts in TSC and TAND, again, keeping the Loren spirit in mind, to work with people in participation, to generate a biopsychosocial whole system plan for intervention, not focus just on the medical or just on the psychological aspect, also take into account the entire system around the individual, to be as evidence-based and evidence-informed as possible, which is not always easy in a rare disorder, and to strive for optimal functional outcomes and quality of life throughout the journey with TAND and TSC. Many families and researchers and a lot of research money goes into finding ways to cure TSC, and which is obviously, if that would be possible, the ultimate goal to achieve. But meanwhile, almost nothing is done to think about how we can improve the current situation of families living with TSC while we are waiting for this magical cure to be found. So that's important to keep in mind as well. So screen, act, repeat, and when we act, biopsychosocial. So the recommendations also have been published in GNDD in last year, also freely accessible for you to consult if this might be as an inspiration. Then we move to the next step, and that was the development of this toolkit. So starting from these recommendations, we went through a whole process of thinking about what adaptations are needed, and we made a number of important decisions on how to organize and bring together all the advice in a way that makes it accessible for patients and families. And so what we decided to do is to, and I'll briefly go to the next page. Here you see the landing page of the TAN toolkit. So it's also online. We decided to link it to the app, but to not to code it into the app as a in the app frame, but to develop it as a web-based tool. So it's linked to the app, but it's a web-based toolkit. So that makes it much easier for us as consortium to make adjustments and adaptations and to have it under our own control to make sure that it stays accurate and up to date. We decided to each time to have a landing page, to give access to the consensus recommendations, but to put the clusters at the core of this toolkit. And here you see the different icons for these different clusters. And so the idea is that people can, when they fill out their checklist and they get their profile, as I illustrated you earlier, the cluster profile on the app, and for example, they see that they score very high in the overactive impulsive cluster, they will be able to click on it and land on the specific page for this cluster. And then first they will get a little video and more information what this cluster is about, why they might have landed on this page. And then there will be information on things to seek and things to do. The what to seek is really give more information and bundle information for families to think about what kind of assessment would be helpful, which kind of professional might help us to navigate these difficulties. And on the other hand, the what to do page contains a lot of information about interventions that people and families can already try out themselves at home while they're waiting for professionals to navigate the journey with them. So that's in a nutshell the toolkit. It's very brief. It's a lot of work that went into that together with the whole community. And you can have a look at it when you look at the tantoolkit.org. So next, we also wanted to validate this further. So I already told you very briefly that we did a validation, feasibility, and acceptability of this new version of the TAN checklist. We did the same also in a number of steps for the TAN toolkit. Then we integrated the checklist into the toolkit, as you can appreciate here below. And then we did a final user acceptance test with a varied group of stakeholders. So here, visually, the web-based toolkit was tested or validated within the consortium throughout the TSC Alliance and throughout TSC International. And then the combined app-based toolkit was validated by the Belgian families. And we used a mixed method approach to do that. So very briefly, also, I'll go a bit faster here. Feedback on this on the TAN toolkit first. So the web version, as you can see, also very positive comments. And then this is a snapshot on how the integrated toolkit, what it looks like. So here, for example, if you click on the scholastic cluster, because this scores the highest in this individual, it will bring you automatically to the scholastic cluster page in the TAN toolkit with the video to start and then further information on what to do and what to seek. And then this is a few screenshots from the the validation that we did with the families from Belgium and the Netherlands on the entire version of the checklist and the toolkit together. And again, that was received very well. The most important feedback was related to language access. You can imagine the whole toolkit and the checklist in English currently. The toolkit can be used with an automatic language translation in a web browser, for example, but still people felt that it would be very important to make sure that the app and toolkit also become available in other languages. And they also had a couple of recommendations on mobile view optimization. So what's next? What do we still need to do, or what did we decide to do? We very carefully went through all the feedback that the families gave throughout these different moments of evaluation, and we decided to see what is important to adjust to the app and the toolkit before the app goes live. So that now has been sent to the developers, and we're in the process of finalizing these last changes before this app can be launched on the App Store. And so once that is in place, this will allow us also for large-scale data collection on TAND. And the idea is that this could then lead to an impact loop that could inform us on further research questions and other new information to further improve the management and have more evidence, to have a better evidence base to make recommendations for the evaluation and management of TAND. So that formed the basis of a next project, a Tandem 2 project that will be funded through the Department of Defense and has three aims. In the first one is to look at the evolution of the construct of TAND over time, because so far the only thing we have are information in a specific moment, but there is no information on the evolution of TAND in an individual. And it would be very helpful also if we would be able to predict trajectories, for example. Also very important when we do research on interventions, that we know the natural evolution of TAND profiles over time, and that we can take this into account when we do an intervention, that we are sure that we look at the effect of an intervention and not just of the natural evolution of TAND over time. The second one is to look more in detail to the aspect of caregiver well-being as a mediator of TAND severity, now that we have means to score TAND severity because of the TAND SQ checklist. We might use that also to evaluate the impact of caregiver well-being on the severity of TAND. And we will also propose to do a pilot caregiver well-being intervention. I'm sure this also would be something that Loren would absolutely approve of. So to end, lessons learned, three highlights from my side. The first one, very importantly, I think Loren also showed that it is possible to use data-driven methods to reduce complexity. It's something that I really learned also from her, that I was not familiar with before, but I think it has made a very big difference in this, in the field of TSC and the field of TAND, to make it easier to speak a language that healthcare providers are more familiar with. Instead of having a TAND profile, a specific TAND profile, when we can put the highlights, where are the most important difficulties? Are they with mood and anxiety? Are they with overactive behavior? Are they with autism-like problems? That really makes it easier at school, in the work environment, to make sure that management is put in place for families. The second one is that app development does come with a lot of challenges. It is something that we as clinicians and researchers were not so familiar with. We have had a lot of support in our consortium, but there are a lot of things to take into account with respect to privacy policy, with respect to what the app, is it classified as a medical device or not? And I will spare you the details, but it's important, and we will also share this with the community to prevent others that might be inspired to come to see, to have the similar challenges. And then last but not least, I think this tandem project really and the priority setting exercise are two examples of the power of multi-stakeholder participatory research. And I think it has really changed also my approach to research, just to make sure that the time we invest in research, what we do, that we are sure that it is of relevance and in line with the needs of the community that we serve and work with. And this is something that was truly inspired by Loren's work and her person. So I think we can end with her motto that research, as Prof. De Vries already said, research is a tool to empower communities. And so I think this really pays tribute to her spirit. Thank you.
Wonderful. Thank you very much, Anne, for that. I think we're going to start with a round of electronic applause for you.
Thank you.
And what I'd like to suggest, let's stop sharing and then let's open the conversation up to anyone who wants to make a comment, who wants to ask a question, or to make any observations. So if anybody would like to ask, you can put a question or a comment in the chat. You can just turn on your screen. You can put up your hand. Any of the